What is it? I just seen a major.
Marcus is at the local high school football game. He's watching his grandson play football with his family. Marcus has had a long day. He supervises several construction sites. He's been on his feet all day. He had to solve a lot of issues at the site. He barely made it to the start of the game. It's halftime now. It's a close game against their crosstown rivals. Marcus is not feeling well, and for the past week, he's been having some chest pains and at times has been short of breath. He starts to leave the crowded stands to get some air. On his way out, he collapses in front of you. What should you do?
All right, so Marcus collapsed. What would y'all do?
Run over to him.
See if he's still breathing. You gonna run over?
See if he's still breathing.
You gonna see if he's breathing? Anything?
Feel his pulse.
Feel his pulse? Anything?
Call 911.
I'll just make that.
Y'all probably need to call 911 first, but y'all gonna look crazy.
Check for head injury.
Head injury?
My bad. I'm watching my Grey's Anatomy.
No, y'all killing me with Grey's Anatomy. Grey's Anatomy, not the Bible of hospital. That's all my scenes like. Grey's Anatomy. I'm like, I'm gonna stick to Grey's Anatomy.
What should you do on his way out? On his way out. Is Marcus having a heart attack? Heart attacks occur when the blood flow to the heart is blocked, causing part of the heart tissue to die. A heart attack is also referred to as a myocardial infarction. Heart attacks can be quite serious and even fatal, but many times they are minor and even go unreported by the victims. Victims that are suffering heart attacks have crushing chest pain. They feel pain in other areas of their upper body, such as the left arm and shoulder, jaw, and neck. Shortness of breath is also common. Other signs include dizziness, nausea, and even vomiting. However, victims of a heart attack usually do not collapse like Marcus did.
So heart attacks, so most times people think about chest or chest pain, they think of heart attack. So heart attack is different from cardiac arrest. Heart attack is also called myocardial infarction, or we'll just say an MI. That somebody might have. So you might have like chest pain, you might sweat, you might throw up, you might have like arm down your left side, because remember your heart is on your left side. So you might have like jaw pain, shoulder, neck, arm pain on that left side. So those are like some symptoms. Women that suffer from heart attacks sometimes don't have any symptoms of having a heart attack. So, some people think it might be like indigestion or something, and it's a heart attack. So it just depends on, that individual, what kind of pain, symptoms they have.
I can.
Marcus has just suffered a cardiac arrest. The term heart attack is often mistakenly used to describe cardiac arrest. While a heart attack is serious and can eventually lead to a cardiac arrest, the two are not the same. A cardiac arrest is much more serious. If we look at the individual words, we find that cardiac means related to the heart, and arrest means stoppage. So, simply put, cardiac arrest means heart stoppage. More precisely, a cardiac arrest is when the heart stops effectively pumping blood through the body. A cardiac arrest occurs suddenly and often without warning. However, about 50% of the victims do have symptoms such as chest pains and shortness of breath as much as a month prior to the event.
All right, so some of cardiac arrest, you won't have any symptoms. Sometimes you will have symptoms, and we talked about when I asked y'all on the bell ringer what is cardiac arrest. So it's when the heart stops effectively pumping blood throughout the body. So that is how everything works. The blood is pumping, the heart pumps the blood, so the blood goes to different parts of the body. So your lungs and your heart work together So if something is gonna stop, so if your heart stops, that means like your lungs won't be getting blood, other areas, your brain won't be getting blood, all these places won't be getting blood. And that's what, you need all those things to work together in order to live. So that's why it's important to learn CPR and to know um, what to do so that you can prevent some of these things from happening. All right, which is more serious, a heart attack or cardiac arrest?
That left side.
Or just like cardiac arrest.
Cardiac arrest? Right, because your heart actually stops.
What is causing Marcus's cardiac arrest? There are many causes that can trigger a cardiac arrest, such as choking, drug overdose, severe trauma, electrocution, respiratory shock, and a heart condition or disease. It is this last category of causes that can result in a cardiac arrest occurring seemingly out of nowhere, like Marcus's. This type of cardiac arrest is referred to as a sudden cardiac arrest. Marcus's long-term heart condition has caused his sudden cardiac arrest.
I mean, it doesn't matter. I'm just playing with this microphone because, like, when I listen
The heart
to
has
it,
an electrical system
when I
that
listen
controls
to
how
it,
it beats.
I sound muffled.
An electrical signal causes the muscles in the bottom chambers of the heart, or ventricles, to contract and beat. This results in blood being pumped through the body. Problems with the heart's electrical system can cause arrhythmias. Arrhythmias are changes in the heartbeat's normal rhythm. An arrhythmia causes the heart to either beat too fast, too slow, or in an irregular rhythm. Most arrhythmias are harmless. However, some issues are serious and can cause the heart to stop effectively pumping blood through the body, thus leading to a cardiac arrest. Common arrhythmias related to cardiac arrest are ventricular fibrillation, or VF for short, and pulseless ventricular tachycardia, or PVT. As the name suggests, VF and PVT are arrhythmias related to the ventricles. Arrhythmias are not the only problem with the heart's electrical system that cause cardiac arrests. For example, pulseless electrical activity, or PEA, is a condition where the heart's electrical signal does not produce a beat, thus leading to a cardiac arrest.
No, it's a microphone because I got the mask on. So when I record, if I'm standing back here, I sound muffled. So I'm trying to see if it sounds better. Go ahead.
Go back.
Yes.
The heart has an electrical system that controls how it beats. An electrical signal causing the heart's electrical signal does not produce a beat, thus leading to a cardiac arrest.
So just center it so we can see everything. I'm gonna say something.
You see it now? Yes.
Yes. So you know that your heart is a pump. Like I said, it's the size of your fist. It pumps. That's your heartbeat. When it goes, it contracts. It contracts and relaxes. So your heart is pumping. Um, like we talked about before, and we talking about the bell ringing. Your heart is pumping, and like we're just sitting here relaxed, talking. You have a normal rhythm. So we expect heart to be in a normal rhythm. However, sometimes your rhythm can change, and when your rhythm change is not normal, it's called an arrhythmia. So arrhythmia, that's when it's not normal. So you have some arrhythmias that aren't life threatening, like it's not gonna like bother you. It might, it's just some people just have arrhythmias that they're not in normal rhythm that we want to be in. However, if you are having cardiac arrest, there's a couple of arrhythmias that your heart could probably be in. You have ventricular fibrillation, which is VF, and you also have pulseless ventricular tachycardia, which is pulseless VTach. Do y'all remember what tachycardia means? Y'all know what cardi is, right?
Cardi.
No, not cardi. You know what cardi means?
Yes.
What's cardi mean?
I used to say Cardi.
Cardi. C-A-R-D-I. What's that? Come on, medical terminology. tachycardia.
I was heart too.
Heart, yes.
Yeah, heart. Okay.
So do y'all remember what tachy means?
No.
Tachycardia?
I don't.
You said techie. Spell.
Tachy, tachycardia.
Is it dealing with the?
It's dealing with your heart.
Is it the thing that connects?
No.
I don't know what that. I forgot.
Tachy means fast. So what do you think tachycardia means?
Your heart too fast?
You got a fast heartbeat. Remember, your heartbeat 80 to 100 beats per minute. If it's over 100, that means you're tachycardia. Over 100 is not, it's not like traumatizing. If it's a little bit over 100. However, when you start getting like really, really fast, then that's when the problem starts. So tachycardia, your heart is beating too fast. That's what it is. Both of these rhythms start in the ventricles, or in the ventricles. Remember, you have atria of the heart, you have ventricles of the heart. So these are what in the ventricles. So they're arrhythmia. So you can go, if you're in these rhythms, you can go into cardiac arrest. So that's why it's important to know how to do CPR, also to use an AED. AED is gonna, that's why it's important, like when you are going through CPR and you recognize that you need, you need emergency personnel to come, you want them to bring an AED, because the AED is made to try to put the heart back into a normal rhythm, because we don't want our heart to be in B field. We don't want it to be in B field. We don't want it to be in pulses V tach. We want it to be a normal sinus rhythm. So the purpose of the AED is going to be to shock your heart back to a normal rhythm so you can get out of cardiac arrest. All right, now you can go. All right, what heart issues can cause cardiac arrest?
Circulation.
Okay, somebody said circulation, somebody said electrical. Which one y'all going with? I said circulation, click that. Nope.
Electrical.
Try electrical.
Bam.
Electrical is right. So if you have something electrical going on in your heart, then it can cause cardiac arrest. What is an abnormal heart rhythm that makes the heart unable to pump blood effectively?
And it's B field.
It's B field.
Yeah, I learned that from Grey's Anatomy.
B field is right, but it is an arrhythmia. You can just come in it. It is an arrhythmia.
How serious is this for Marcus? Marcus has stopped breathing, and his heart is not pumping blood through his body. This is known as clinical death. In the medical field, there are two types of death: clinical and biological. Clinical death is when breathing and blood circulation stop. These are two conditions needed to sustain life. During clinical death, most organs remain functional. Clinical death can be reversed. Biological death is when organs, especially vital organs such as the brain, die and can no longer function or be revived. Biological death occurs shortly after clinical death. Marcus is clinically dead.
Center it, like move the bar over at the bottom. Go up. Alright, so this is the difference between clinical and biological death. Clinical means that their breathing has stopped and their blood flow has stopped. And then biological is when organs can no longer function or be revived. So if you are clinically dead for too long, meaning say somebody collapses, like for example, they're giving us Marcus as an example. So Marcus has collapsed. Okay, Marcus is somewhere where nobody knows CPR, so he's just chilling. He's just on the ground, like no breathing, no pulse. If he stays down there too long, biologically he's going to be dead, because the longer that you don't do anything, the worse it's going to be. The longer you don't do anything, heart stops, which we know it's probably already stopped. lungs, everything stops. Brain, you're not getting blood flow to the brain. So that's when you're gonna be, dead. Like there's no coming back. That's biologically dead. Clinically is when you can do something to try to help. You can do CPR. So we want to do CPR to prevent clinical death from trying to end to biological death. Does that make sense? To y'all?
It does.
Okay. Okay, you can go.
The main function of the heart is to pump blood through the body and supply it with oxygen. During a cardiac arrest, the heart can no longer pump blood. This has very serious consequences to vital organs, such as the brain. Within 20 seconds of a cardiac arrest, the victim loses consciousness due to lack of oxygen to the brain. After about 1 minute, brain cells or neurons start to die. After about 3 minutes, neurons begin to suffer more widespread damage. After 4 minutes, lasting brain damage is likely. After 6 minutes, biological death becomes imminent. After 10 minutes, a coma and lasting brain damage is almost inevitable. Shortly after that, survival is nearly impossible. As you can see, a cardiac arrest is a very serious condition. This is not good for Marcus or his family.
All right, so with this, like I said, you want to start CPR as quickly as possible if somebody goes into cardiac arrest because after so many minutes, things start shutting down. Like they said, after 4 minutes, then the blood supply to the brain is lost. So then they can have even if y'all get them back, if they are revived, they could be brain dead because they've been without oxygen for so long. All right, you can go next.
Time is critical for Marcus. Quick action is needed. While Marcus is clinically dead, there is still a chance that he can be revived. Marcus's chances of survival can be increased if he receives basic life support. Basic life support, or BLS, generally refers to a level of emergency medical care given to victims of cardiac arrest, respiratory distress, or an obstructed airway. In this module, you'll learn BLS methods and techniques that someday could save a life.
So, because Marcus is clinically dead, he needs CPR. So he needs CPR, he needs an AD, and these things are helpful in trying to prevent biological death. So that's the purpose of learning CPR, because we want to make sure that that person is not, dead.
So what's she touching? I mean, what is that right there?
His chin
Why she touching
or
your
jaw, huh?
Or why she touching your
Because when you give breath, when you're doing CPR, you got to do a head tilt, chin lift. So that's what she's doing. Because when you give breath, you want to make sure that the breaths are going into his lungs. If his head was just kind of straightforward, then the tongue could get in the way and it'll prevent the breath from going into his lungs. So you have to do a head tilt, chin lift. Y'all learn all that. Get next.
In this lesson, you learned about cardiac arrest, the difference between a heart attack and cardiac arrest, causes of a cardiac arrest, what happens to the heart during a cardiac arrest, about VF, PVT, and PEA, the speed of damage caused by a cardiac arrest, and how BLS can help during a cardiac arrest.
All right, scroll over. I think you can exit somewhere. And scroll up. I can't make my face bigger. I mean, smaller. No, you know, set the
Can I
thing.
move it?
Oh, yeah, just drag it. Okay. It used to let us make it smaller, but I can't. It won't do it. Let me see. There it is. Hit exit right now.
Did I even get?
Did you get what?
I'm trying to see did I even get in.
Oh, did you log in? I thought you did.
During this lesson, you will.
All right, so this part we're going to learn about cardiac arrest in the U.S. We're going to learn about the goal of the American Heart Association concerning cardiac arrest. So American Heart Association is a company that your CPR is through. So I am an American Heart Association CPR instructor. So I do BLS and I do CPR. You're gonna identify the chain of survival and the basic life support links to the chain. You're gonna learn the basic steps of CPR. You're gonna learn how CPR and defibrillation help cardiac arrest victims. We're gonna understand defibrillation and shockable rhythms. That's like fib and BPAP. And then we're gonna recognize when not to start and when to start BLS, and then we're gonna learn about BLS certification. So you can go to the next one.
A cardiac arrest can be sudden and unexpected. It can happen anywhere, at home, at work, at a sporting event, even in a hospital. Cardiac arrests are most common among older men, but they can happen to anyone, females, young adults, and even children. And they can happen to any race, white, black, Latino, or Asian. Cardiac arrests are a leading cause of deaths in the United States.
So cardiac arrests don't discriminate. You can be young, you can be old, you can be male, you can be female, you can be white, you can be black, you can be Hispanic, Asian. No, it doesn't discriminate, so it doesn't really matter. And it's a leading cause of death in the United States. Okay, you go next.
According to the American Heart Association, or AHA, there are about 560,000 cardiac arrest cases in the United States every year. Just over 350,000 of those cases are out-of-hospital cardiac arrests, or OHCA. The other approximately 210,000 cases are in-hospital cardiac arrests, or IHCA. A victim's chance of survival decreases by 10% for every minute that passes after the cardiac arrest. That means that after about 10 minutes, if the victim is not resuscitated, there is almost no chance of survival. Of the roughly 350,000 OHCA cases, there is only about a 10% chance of survival to discharge from the hospital. For the 210,000 IHCA cases, the chance of survival to discharge is not much better, about 21%. The combined chance of survival is about 14%. Those are not very good odds. This means about 470,000 victims of cardiac arrest die each year in the United States. Can we do better?
Scroll down. Okay, so for every minute after when they go into cardiac arrest, for every minute that victim's chance of survival is decreased by 10%. So that's why it's important to make sure that you, if you are witnessing somebody that's going into cardiac arrest, that you do something. You do chest compressions most importantly. Call for help, get somebody to come help you, because the longer you wait, the worse it's going to be for that person, and it could mean death for them. All right, you can go next.
The AHA, a nonprofit organization, is a world leader in the science, education, and training of CPR and emergency cardiovascular care. One of their goals is to improve the outcomes of cardiac arrest victims. Their long-range wish, of course, is to have 0 deaths resulting from cardiac arrests. However, for this to occur, more practical intermediate goals are attempted. For example, between 2010 and 2020, it was their goal to increase survivability from about 8% to 15%, quite a challenge. Any goal can only be reached through the constant improvement in treatments, processes, and education related to cardiac arrest. Remember, every 1% increase in the survival rate translates to almost 5,000 saved lives in the United States. Chain of survival. The AHA defines an integrated set of actions to provide the best chances for survival and recovery after a cardiac arrest. The AHA refers to these actions as a chain of survival. Each link in the chain must be strong for the whole chain to be effective and increase the chance of survival. Depending on a situation, in hospital or out of hospital, adult or pediatric, a different version of the chain of survival may apply. The links include early recognition and prevention, activating the emergency response system, high-quality CPR, defibrillation, advanced resuscitation, post-cardiac arrest care, and recovery.
All right, so on this one, if you look at the different chains, so if you're in hospital, so that's adult in hospital cardiac arrest, early recognition and prevention, that is noticing, kind of like signs of somebody that might be going into cardiac arrest, or even seeing them collapse or whatever. So if you see them collapse or whatever, then you're gonna have activation of emergency response. So that means you're gonna call EMS to make sure somebody gets there, brings the AD. High quality CPR, you're gonna perform that defibrillation, that shocking the patient. Then the things you do after the cardiac arrest and their recovery, because all of this is crucial. And then you have, if you're out of hospital, that means like if you're somewhere and they go into cardiac arrest, like not in a medical facility, of course you're gonna call 911, high quality CPR, defibrillation, advanced resuscitation. So that is ambulance. They're gonna have more equipment than you would have if somebody collapses in front of them.
You gotta give a specific name for what you need them for.
What you mean?
Like when you call the ambulance, like
No, you just can tell them you got a somebody that's in cardiac arrest, and they're gonna just ask you where you're at, I guess. Yeah. And then here, how they have the activation of emergency response, like in hospitals, like we had in each room they have like a button on the wall, and if like you walk in and somebody is in cardiac arrest or unresponsive, you could just hit the button and then it'll start going off. Everybody's beepers will start going off. They might say it overhead, code blue in whatever room it is, so everybody knows. So that's actually what activation of emergency response is in a hospital. Activation of it here is you're actually calling on the phone, calling 911 or whatever. But if you're in the hospital, they have things in place. I know my husband, he's an EMT, so at the hospital he worked in the telemetry room, and that's the room where they sit there and they look at all the different heart monitors. So according to what rhythm the heart is in on the screen, they would if they went into a rhythm like B-fib or B-tac, because those people are very well trained in all the different rhythms. He knows all the rhythms of the heart. I don't know, he might be a little rusty, but he can look at the rhythm and tell you what it is. So they sit there, that's what they do all day or during that shift all night. They watch the rhythms on the monitors in this room, this little bitty room, and they're watching the monitor, and the patient goes into one of these rhythms. They have a phone, they'll pick up the phone. They don't have a button in their room. They'll pick up the phone, and it's like at each nursing station, there's this big old red phone. If that red phone rings, we know somebody's coding. So they'll call the phone and they'll be like, you got B-Tech in room, whatever. And so the nurse might go check or somebody go check. And then if it's a real true code, because sometimes patients do stuff, they'll pull their leads off or they can be doing something crazy. So they'll go check. If it's a true emergency, then they'll hit the code button and everybody will start coming to assist. And it can get a little crazy because there'll be a lot of people in there.
The chains of survival are integral in basic life support, or BLS. There are slight differences in the chain of survival based on the age of the victim and the location of the cardiac arrest. The common steps among all four are early recognition, high-quality CPR, and defibrillation. Healthcare providers, such as home health aides and CNAs, public safety personnel, such as police and firefighters, and others who might respond to a health emergency, such as lifeguards, personal trainers, and dental technicians, must learn the chains of survival and BLS so they can act quickly and correctly in emergency situations involving cardiac arrest.
I wasn't playing this game. yeah, so having BLS is important. Like, if you might have a job that, babysitters, like if y'all babysit, I don't know if I want y'all babysit, but anyway, if y'all babysit folks' kids, that's a good thing to put down, like that, CPR, because something happened, I don't know, y'all might still not try to help. I don't know what y'all do.
I did look at them. Because if you had little kids, you'll let some of your students, babysit your children. Why?
I don't know. Y'all probably be on TikTok and not watching the kids.
Trying to be on TikTok with her.
No, trying to talk to your little boyfriend and girlfriend, and then my kids swinging from the lights or something. No. I used to babysit when I went to college. I worked at a daycare, and then I used to babysit, but they pay so good. They pay some good money. They used to just pay you like, so the mama was she was a physician's assistant, and the dad was what was he? He was some sort of doctor. So she got like breast implants. They paid me because she couldn't lift the kids. They paid me just to come over there and lift the kids.
So what you doing? Lifting and doing what?
Like if the baby wanted to get picked up, she couldn't pick her up because she had got her boobs done.
How much they paid?
I don't even remember. That was 20 years ago, but still. But then you was buying me food. We were going places. You were buying me food there, and you was paying. I used to love it.
You work at a daycare?
I think when
I was in college, I did.
I think when I get old, I want to go sit with the old people. They make a lot of money.
See, I couldn't do that because I'll be sleeping.
You can go sleep.
Well,
I'm gonna go sleep.
I don't sleep on the job. I can't go to sleep while I work at. Like, people used to go to sleep at work in the hospital. I couldn't do it. Only time I got sleepy was when I was pregnant, and I was just too fat to care about what was happening. So, and it was tiring to work around a hospital with a big old watermelon in your stomach. So I used to sit down and just we'll have a cold, and I'll be like this. You're supposed to get there fast. I'll be like this. They'll be like, just sit down. I'm like, okay. I'll be here when y'all get back. I used to try though. I was trying to get up and help, but alright, go to the next one.
You want to be a lifeguard?
Who want to be a lifeguard?
Me.
Today you can swim.
I can swim too. I went to the wine.
First link in the chain of survival. If a person is in the hospital and experiencing cardiac arrest, the first link in the chain of survival is early recognition and prevention. If a person is out of a hospital, activating the emergency response system by calling 911 is the first link. Recognizing the symptoms of cardiac arrest is crucial. These symptoms may indicate a person is in cardiac arrest. Unresponsive, not responding to touch or sound. Absence of normal breathing, not breathing, or is gasping unsuccessfully for breath. No circulation. Victim does not have a pulse. Once a cardiac arrest victim has been identified and the emergency response system activated, it's important to start CPR immediately. CPR is short for cardiopulmonary resuscitation. Breaking down these words helps to provide a meaning for the phrase. Cardio means heart. Pulmonary means lungs. Resuscitation means to restore to life. Therefore, cardiopulmonary resuscitation means bringing the heart and lungs back to life. CPR, if done properly, can keep a critical amount of oxygenated blood flowing to vital organs, especially the brain.
Scroll down, let me see what's on the bottom. We talked about that, cardio means heart, pulmonary means lungs, resuscitation means restore to life. So you're trying to bring that person back to life, or the heart and lungs back to life. So that's why it's important, and that's why you should know how to do it correctly so that you can be successful. All right, you go to the next one. All right, what does cardiopulmonary resuscitation mean?
Right here.
The last one, bringing the heart and lungs back to life. Correct.
When you smart like me, you don't know this stuff.
Okay.
Good.
You know what?
CPR can be performed in 3 basic steps. The letters C, A, B, or CAB, can be used as a guide to remember the steps and their order. C for circulation, A for airway, and B for breathing.
All right, so these are the 3 steps to remember how CPR goes. So circulation is C. That is the first thing you'll do is you're gonna do chest compression. So that's circulation. So that's the first thing.
They gotta have their hand like it.
Mm-hmm. Then A is for airway, so you're gonna open your airway, like how tonight asked me about how the lady had her hand on his under his chin. That was opening the airway. Then breathing is actually doing the breath, so it's CAB. All right, next.
You got too much. I try to see
The circulation step is when the rescuer gives chest compressions on the victim's chest. The compressions squeeze the heart, forcing it to beat and pump blood. The blood carries oxygen to the body, especially the brain. Unfortunately, even if properly performed, a chest compression only pumps about 30% of the blood volume supplied by a normal beating heart. That's why chest compressions need to be given quickly and without interruptions.
All right, so C we know stands for circulation. That is when you give chest compression. So the compression is gonna squeeze the heart. So you're pumping, you're beating on the heart. You want it to pump blood through the rest of the body. So go to the next one.
The airway step is when, after a series of compressions, the rescuer opens the victim's airway, typically by tilting the victim's head back, lifting the chin, and opening the mouth. This lifts the tongue off the back of the throat and prepares the victim to receive rescue breaths.
So that's that. That's when you'll do a head tilt, chin lift. That's gonna open up your airway in order for you to give breaths to get air down into the lungs. All right, next.
The breathing step is when the rescuer delivers rescue breaths to the victim. Rescue breaths fill the victim's lungs with air. The air contains oxygen that can be absorbed by blood in the lungs and delivered to the body during compressions. Each breath a person inhales contains about 21% oxygen. Only about a quarter of the oxygen is used in the body. The remaining portion is exhaled. This means rescue breaths can contain about 16% oxygen, which is plenty of oxygen for a victim.
All right, so breathing, that's when you're actually gonna give rescue breaths to somebody. Like you, chest compressions come first. You'll do 30 chest compressions. Then you'll do open up the airway, head tilt, chin lift. Then you're gonna give them breaths. Um, I would not do breaths now in a pandemic. Well, I wouldn't have did breaths before. If I was out somewhere and I didn't have a barrier device or like a mask or something to use, the most important thing that you're gonna learn is that just to do chest compression. That's gonna be the most effective, doing your chest compression and also doing your using your AED. So you can keep that up until somebody comes, especially like if you're not in a hospital facility and you're somewhere like out, like if you're, in the mall or somewhere where something happens and you need to do CPR and you don't have a thing. I don't think I got it on my desk. Um, I'm gonna try. I usually try the people that do take CPR and pass it. I usually try to get them one of these. Mine's all dirty because it's been in my pen box thing. Where I keep all my pens. But it's just a little packet. It kind of goes on your key ring and it has a mask in it. So like if I'm somewhere and they need CPR, I can just pull it out.
So you carry it?
I don't care. I keep this one in here, but I mean I can have one. I don't want to change. I can get it out. There it goes. But it's just like a little face shield, and if you have to do CPR,
For that bag you gave me?
huh? It's just like a face shield, so it'll protect you from like if you have to get mouth to mouth with somebody. And it's only single use. Of course, I've taken it out to show people before, but
And you don't want them not to touch your mouth and do that?
Yeah, you don't want that girl, you know. I mean, I wouldn't have done it before the pandemic. I'm especially not gonna do it now. So, I mean, they'll probably be all they will get. But I would do some chest compression.
You still gonna get Corona?
Also, my mask is gonna be on.
So how you gonna do?
They're not gonna get it. They're gonna get chest compression. That's it. But like I'm saying, like if you want to, they have these. And those of you that do take your CPR class, I'll probably try to get y'all some.
What?
I know I'm bad.
Y'all go ahead and put on y'all keychain so y'all can feel official. Take a picture of it, post it on TikTok, Instagram.
I saw a relation that the man was breathing, so they did like this. And went quiet, it wasn't working.
You saw what?
I'm right laughing, but look. They went too far, it wasn't working, right? Look. They said, he said, and I'm laying on my damn work. You can do that, can't you?
You want to have that?
I don't know what you're talking about.
Okay, they going too far, right? It wasn't working. So the man took his hand, he did like this in here, and this man checked. He said, that man danced so hard, he got out of here.
Yeah,
You can do that, can't
you? Yeah, you try to. Hold on, Mark. Look it up.
you? Like a scary movie, he kept slapping the way out of that cake.
All right, hit next today.
If a cardiac arrest victim's heart is in ventricular fibrillation, VF, or pulseless ventricular tachycardia, PVT, then defibrillation is the best way to restore a normal rhythm. A defibrillator is a device that delivers an electrical shock to stun a heart in VF or PVT back into a normal rhythm. However, a defibrillator may not be immediately available. Therefore, CPR is used to prolong the time a victim can survive until a defibrillator is available. BLS rescuers will typically use an automated external defibrillator, or AED. An AED provides voice instruction on how to use the device. This includes when to stop CPR and to allow for the device to check for a shockable rhythm, such as VF or PVT. Not all cardiac arrest situations have shockable rhythms. If the rhythm is shockable, the AED will tell the rescuer to deliver a shock.
All right, so defibrillation when you're outside of a hospital, which I don't have mine available. I need to get a new AED because mine are old. We don't play them out. So you have an AED. It's this little electronic device, and it looks similar to this. And we're gonna once we start actually doing the hands-on part, I'll pull it out. But it looks like this, and it has little pads on it, and it's in a little case. And the little pads are gonna show you exactly. So it's kind of like dummy proof because it's gonna show you exactly where to place them on your patient. So here you see one that's telling you to put it on the upper right chest. So you have two pads. Most important thing to do is remember to turn it on, and it's gonna talk to you. It'll be like once you power it on, it'll be like place pads on patient or open this, or it'll tell you. So what it's doing is it's like a little electronic device. What it's doing is looking at the heart rhythm. So this is the heart rhythm right here. So it's looking at the heart rhythm, it's reading the heart rhythm, and if it's in VTAC, which we talked about earlier, or VFib, it's gonna tell you to shock them. So it'll say analyzing heart rhythm, and it'll analyze the heart rhythm. So when it says analyzing, it's looking at the heart rhythm. So once it detects what heart rhythm it is, if it's one of those, it's gonna shock. It's gonna want to shock. So it'll say shock advised, and then it'll say something like, well, all of them say, I mean, they're similar, but it might be different. It'll say charging. So it's charging. You're still doing CPR because you're still trying to get that heart to start back. So, and it'll say stand clear. And when it says stand clear, that's when you tell everybody clear because you don't want anybody to be touching the patient when you deliver the shock because they can get shocked as well. So when it says stand clear, whoever's operating this part will say everybody clear. And then when it tells you to shock, you'll press that button. It'll deliver shock, and then it'll analyze again. And if it takes it out of this VFib or this VTAC, that's what you want. You want it to shock it and that they come out come out of their arrhythmia into a normal rhythm. However, it doesn't always work that way. So if it doesn't, it'll tell you continue CPR. But while it's doing that, you're going to check for a pulse to see if you have a pulse. Because you do not do chest compression on somebody that has a pulse. So you're trying to get the pulse back, because remember, you done checked it and there's no pulse. Now you're doing CPR. You use your AED to try to shock the heart back into a normal rhythm where you can feel a pulse. If not, it's going to tell you to do CPR. Now, this machine is not going to let you keep just pressing the shock button. Only going to deliver a shock every 2 minutes. So you can press the shock button, but nothing's going to happen. Not until it tells you to shock will it shock. So that's another good thing, because people might just be pressing the button, but it's not going to do it. So it's still analyzing still while you're doing chest compression. So that's why this is important and effective for CPR. CPR can be performed in 3 basic steps. What letters can be used? CAB, CAB, circulation, airway, and breathing. All cardiac arrest situations have shockable rhythms.
Wait. True.
You think it's true?
Wait, Claire, I think it's true.
You said no? You think it's false? I think it's false. It's false. Now, y'all heard of flatline, right? Flatline. Y'all know what flatline is? Y'all never heard of flatline? When the line is flat, when the rhythm is flat. Asystole, she knows because she watched Grey's Anatomy. That's asystole. The AED will not shock if it's an asystole. So that's a lot of times how you know that they're in. And basically, asystole means they're dead. That means the heart is doing nothing.
And that's what you should say when somebody dead.
But I'm saying, yeah, this a medical class. I said flatline, then I say, but the correct term for it is asystole. That means without a pulse.
I knew that right there.
So when it goes flatline and it's hooked to the AD, it is not going to shock. It's not a shockable rhythm. So that's why this is false. You got those two, V tag and V fib. It will shock for. If it's an asystole or flatline or dead, it's not gonna shock. It'll just tell you to continue CPR. So that's how you know, oh, my patient is asystole because he don't have a rhythm.
While the general rule is to...
All right, so there are a few situations where not to initiate BLS. So if there's an unsecured scene, where it could result in injury to the rescuers, like a fire, like I don't see y'all just running the building trying to do CPR on somebody, and it look like this, right? Y'all ain't going in there. I'm not. I mean, unless like my mom or my daddy, I might try to go in there if it looks like I can get in. Then we both gonna be dead probably. But you wouldn't put yourself in harm's way. That's what it's saying. Clear signs of biological death, such as rigor mortis, like you get up or you go to somebody's house and you realize they're dead. Like they've been probably like this all night and they're hard and stiff.
And cold.
Yeah, then you want to do CPR. If they have a DNR order, do not resuscitate. So that's what people, when people start talking about living wills and stuff like that, people write they don't want to be resuscitated. It's crazy.
Especially they gotta be a court. That means we're not court, a vegetable.
Yeah, if they don't want all this other stuff, they're gonna say, I don't want this stuff. Don't do it.
Right, that's gonna be in a recording of it.
No, it's like a document. You can start like, okay, so sometimes we will get these old like little bitty people, like these old little small old people from the nursing home. Well, we don't have none of their information. Well, until we get their stuff, we have to treat them. We have to do CPR stuff. Then their cousin or auntie, or not auntie, but because they're old, their family member comes in and they're like, she's a DNR. So if we go through her medical stuff and it says do not resuscitate, we'll stop.
Teachers and students, please excuse this interruption. Just a friendly reminder. Next week, Monday, Tuesday, Wednesday.